Hi everyone, my name is Kenisha Parikh. I am an oncology dietitian here at the John Theurer Cancer Center, which is a part of the Hackensack Meridian Health Network here in North Jersey. Today we're going to be talking about diet and the importance of nutrition with head and neck cancer. Nutrition is a vital part during all stages of treatment, so before, during, and after treatment. And it's really important for patients to maintain their nutrition to help fight infections, to help prevent weight loss, to help heal, and to help with reducing overall side effects from treatment. So today we're going to be making a lentil soup that helps combat a lot of side effects that head and neck cancer patients face. So while they're going through treatment, the first 1 to 3 weeks, they have side effects like taste changes, nausea, decreased appetite. As treatment goes on a little bit longer, their side effects get a little bit more severe. So things like painful swallowing or difficulty swallowing, mouth sores, decreased appetite, and nausea continue. So we're going to be talking about how to combat that. And this recipe is a perfect way to kind of battle some of those issues that they might face while they're going through treatment. So I have a medium saucepan right now. It's on about medium heat, and I'm going to add about 2 tablespoons of olive oil to that. So olive oil is great because it's a heart-healthy fat. It's a monounsaturated fat. And a lot of issues that these patients may face is maintaining their weight during treatment. So adding something like a heart-healthy fat like olive oil is a great way to sneak in calories without having to eat a larger volume of food. So we're gonna add that in, and we're gonna do about 2 tablespoons. Just coat the bottom of the pan and let that warm up. And then we're gonna add in our chopped vegetables. So the first thing is we have some diced onions here. So we're just gonna add that to the pot. And then we're gonna add chopped carrots as well as bell pepper. So carrots and bell pepper are great because they're rich in vitamins A and C. So those are great for immunity, as well as they add a little bit of sweetness once they're cooked down. So this is gonna be a lentil tomato soup, which can be a little acidic. So we want to add some sweet vegetables to help cut that acidity. Okay, so we're going to add that in, and then we're just going to let that cook down for a few minutes. Okay. So while that's cooking down, I'm going to talk a little bit on how we can fight some taste changes that cancer patients might be facing, specifically those head and neck cancer patients. So the first thing that can help with taste changes is acid. So tomatoes, which is the base of this soup, as well as lemon juice, typically enhance taste to make food a little bit more palatable. The next thing that can help with taste, of course, is adding a lot of spices, seasonings, sauces, herbs. So this recipe is really packed with seasoning. So for this recipe, we have ground coriander, cumin, smoked paprika, black pepper, and a little bit of cinnamon. So a lot of strong flavors that'll come through the soup, especially for someone who's having difficulty tasting, or for someone where things are tasting a little bit more bland, these will definitely come through. So I'm gonna add that in, and then I'm gonna mix it with the rest of the vegetables. And you wanna cook this down until the onions are translucent and until the bell pepper and the carrots are soft to touch. I'm gonna turn up the heat a little bit, and then we're gonna add a little bit more to the soup. So the next thing that we are going to add is a little bit of salt. You can always add more as you go, but this is about 1 teaspoon of salt just for taste. We're gonna add a little bit of tomato paste. We're going to add a little bit of minced garlic, which will help with the taste. And then the last thing we're gonna add is sugar. So we do wanna cut a little bit of the acidity from this recipe because when you're going through treatment, some side effects can include mouth sores or painful swallowing. So for those patients, we want to be careful with the acid. Although it can help with taste, we don't want them to have that burning sensation. So sweet vegetables as well as sugar can help cut that acid to make swallowing a little bit easier, to make it less painful. So we're going to add that in, and then we're going to stir that up. Okay. So now we're gonna let this cook down for a little bit. Okay, so this has been sauteing for a few minutes. So the onions are translucent and the vegetables are soft. So I can squish them down with my spatula, which is exactly what we want. So next we're gonna add the tomatoes. So I have 3 cans of diced tomatoes. You could use whatever variation you like. You could do plain diced tomatoes. These are basil, garlic, and onion just for a little bit more flavor. But again, you could do whatever you prefer. So I'm gonna add these into the soup. This is gonna be the base of the soup, and this is what's really gonna help with bringing out that flavor. So now we're going to mix that in, and then the next thing I'm going to add is lentils. Lentils are a great source of protein. So what I did here is I got the canned lentils because I like things that are a little bit more convenient. If you prefer to soak them and cook them in a pressure cooker or on the stovetop, you can do that as well. But what's great for a lot of patients who don't have a lot of time, get the canned ones. You can drain them and rinse them to get rid of sodium, just that extra salt, and then you can just plop them in your recipe. So we're gonna mix those in, and then we're gonna stir everything together. Okay. Next, we're gonna add the liquid of our soup. So I'm using vegetable broth, just in the spirit of keeping most of this vegetarian, but if you did wanna add more protein, you could use bone broth as a base, you could use chicken broth just to really double on that protein. But we're just gonna use vegetable broth. It's about 4 cups, so that's 1 of these containers. So we're just gonna add that in. And then we're also gonna add about 1 cup and 1/4 cup of water, just to add a little bit more liquid. Now this soup is great because you can batch prep it and then freeze it. So what's great is when patients are going through treatment, I recommend something like a soup like this because they can prepare it, freeze it, and then throughout the week when they don't really have the energy to make meals, they already have this. All they have to do is heat it up. Okay, and then here is the 1 1/4 cup of water. And then we are going to mix this together. Now you just wanna let this simmer for about 15 to 20 minutes. You do wanna stir it so nothing sticks to the bottom, but this will really help all the flavors come together as well as allow the vegetables and lentils to soften a little bit more. So I'm gonna turn it up a little bit and let that get going. To save time, I do have one that has already been simmered, but just to talk you through what you would do the rest of the recipe, once it has simmered for about 15 to 20 minutes, you do wanna puree this recipe. So like I mentioned, a lot of patients going through treatment, they have difficulty swallowing. The reason I like this soup is it's really versatile. So at the beginning of treatment where they can tolerate soft foods, you might not necessarily need to puree it. The lentils are soft, the vegetables are soft, it's moist, so it's easy to swallow. As treatment goes on and further on into treatment where they're mostly relying on liquids, you do want to puree it to get any of the chunks out, but then it becomes fairly easy to swallow. So to puree it, I used an immersion blender, so you just plug it in and then you just have to keep going around. It does take a little bit of time, but it gets everything really nicely pureed. Or you could do it in batches in a regular blender if you have. So once you've pureed it, it turns into this. So this is the pureed consistency. To this, I also added whole milk. So whole milk is a great source of protein and calories. And it's a great way to add protein and calories without adding volume. So I added about 1 cup of whole milk to this. Other ways to sneak in some calories and protein, not necessarily to the soup, but to foods when you're having trouble eating, is avocados, Greek yogurt, peanut butter, olive oil. Adding all those foods can help sneak in calories and protein without adding more volume. So it's great for patients that are going through active chemo and radiation because we usually advise them to eat small, frequent, high protein and high calorie meals. Once I added the milk, the last thing I did was I squeezed a lemon. About 1 medium lemon. This one was a little larger, so I just did half of a lemon. The citrus, again, it helps bring the flavors together and it helps with those taste changes. And then once that's done, all you do is stir it for about 2 to 3 minutes and then you're all set. You're ready to serve and enjoy.